Good afternoon. I'm Dr. Angelo Juan Ramos, Executive Director of SHIP. Welcome to the launch of the Philippine Stigma and Discrimination Reduction Quality Improvement Learning Network. We are proud to be partners of PSMID, UNAIDS Philippines, and UCSF HealthQual. We know that we need to address HIV-related stigma and discrimination in hospitals and other healthcare settings. So, our overall aim is to reduce stigma and discrimination in Philippine healthcare facilities. In the coming months, we will work closely with HIV and AIDS teams from 13 hospitals to determine baseline levels of SND among healthcare workers, develop interventions to reduce and eliminate them, and to find ways to scale up and mainstream initiatives to improve quality of care for people living with HIV and at-risk groups. In a previous workshop, we identified the drivers of stigma and discrimination in hospitals, and these are areas that we need to act on, namely education and awareness, hospital policies, peer involvement, clinic systems, and the routine measurement of stigma and discrimination. We welcome our partner hospitals. For Luzon, we have the Bataan General Hospital, Jose B. Lingad Memorial Regional Hospital in Pampanga, and the Bicol Regional Training and Teaching Hospital in Legazpi. For the Visayas, we have Corazon Locsin Montelibano Memorial Regional Hospital in Bacolod, Cebu Provincial Hospital in Balamban, and Vicente Soto Senior Medical Center in Cebu City. And for Mindanao, we have the Southern Philippines Medical Center in Davao. I now ask you to hear the voices of those who have experienced stigma and discrimination and our partner organizations who are committed towards their elimination. Welcome to the network.
Hello, I'm Dr. Bruce Agans from the University of California, San Francisco HealthQual program, and I'm grateful and honored to be joining you at this all-virtual 42nd annual convention sponsored by PSMID. I also congratulate PSMID on the celebration of their 50th anniversary. That's a wonderful milestone, and as an infectious disease clinician, it gives me great pleasure to be able to celebrate that milestone with my colleagues in the Philippines. And particularly pleased to join SHIP's session on Better Together, focusing on the meaningful involvement of people with HIV in healthcare. SHIP and PSMID have joined together with other donors to support the launch of a very important activity in the Philippines, a quality improvement learning network that is going to focus on reducing stigma in healthcare facilities. They're joining our multi-country network in Southeast Asia that is devoted to this activity. This network is devoted to combating stigma. We know that stigma is a main driver of preventing us from reaching our targets to end the AIDS epidemic. We know that stigma can be harmful and damaging to people. It prevents them from coming into a care setting. Once they're in it, it may prevent them from staying connected to care, and it may trigger major mental health issues as well. Sometimes we forget that our actions can be triggers for stigma, and that we can do something about that. And indeed, stigma is actionable in healthcare settings. We can change the way that we behave, we can change the way our systems are set up, and make them more welcoming and friendlier to people. SHIP has done a wonderful job in organizing the network, in partnering with PSMID, which has led the meetings and come together as a group to recruit a number of hospitals, 13 in fact, all of whom I would like to congratulate on stepping up to join this important initiative. It's a great privilege for me to be able to join you virtually in network meetings. I hope that I'll be able to come in person as well at some point. But I've been so impressed thus far, following on the design meeting for this initiative, with the enthusiasm, with the energy and the commitment that I've seen among providers and people from the community to undertake this important initiative. And it is my hope that once its success is demonstrated, that it will be scalable, that it will be something that can be implemented routinely across the health system, so that we can make care better for people with HIV, and especially for key populations who comprise the HIV and at-risk population, so that we can provide the best possible care to them, so they can have their outcomes achieved with better health-related quality of life, and also achieve our epidemic and population health goals of ending the HIV epidemic. I come back to health-related quality of life and remind us that that's the fourth 90, that not only are we trying to make sure that everybody is suppressed, but we want them to live productive, meaningful, and positive lives. And in doing so, to help make that happen, we want to focus on patient experience and making the healthcare system stigma-free. I hope you have a great workshop. I hope it's been a great conference and continues to be. And again, I look forward to meeting you all in person and congratulate you on the success that you have achieved and will continue to achieve as you move forward with this initiative. Take care.